But the next we have, the next discussion is with Jess Schnur. Jess is a great partner here. Let me get to that. So she's the Donation Support Services Coordinator at the Lifetime of Ohio. Go Bucks. And if you need help navigating your appointments, during the session, she's going to help review some of the basic and in-depth questions to ask your care team. Again, as we're empowering connections here, you want to find out tips and tricks that others are using. Make sure we look at those aspects of pre-appointment prep. Make sure that we're looking at all aspects of managing both palliative care as well as chronic liver disease. So we welcome Jess up to the stage.
Thank you.
Thank you. There's the clicker and a pointer if you need it.
Okay. Good morning, everybody. So today we are going to talk about something that's very dear to my heart because first and foremost, I was a patient that knew absolutely nothing going into this diagnosis. So we're going to do a little exercise first, and I want you guys just to close your eyes. Take a minute, big deep breaths. I'm going to go through a little bit of a scenario, and I want you to raise your hand and leave it raised when I say something that strikes true to you. You've pulled in the parking lot at a hospital or a doctor's office. You're super nervous. You're starting to see a new physician. You've already been told by your primary care doctor or somebody at the emergency room that you're imagining your itch, that you're faking your itch, that it's all just something in your head. So then you go into the doctor and you're nervous and you're thinking to yourself, okay, they're going to say I'm crazy. Anybody feeling like that? Raise your hand. Keep those hands raised. So say you already know, you've been told you have PBC. And so you know going into this appointment with the doctor that I've got PBC and they're going to tell me I'm going to die. So you go in and you get your information and you leave your appointment feeling better about yourself. You feel like you've got a plan. You feel like, well, things may be okay. How many people felt like that? All right, you could go ahead and open your eyes, kind of look around. I saw lots of hands going up and down. We've all felt like that. And some of us have a good first visit, some of us don't. So what I hope to do today is just give you some tips and tricks that I've found because as my role, I'll switch here. Like I said, I've been a PBC warrior since 2014. That entire time I was working in healthcare. I started at the age of 19 as an EMT on a local ambulance service. I did that full-time while I went to college full-time to become a registered nurse. I then worked in cardiovascular ICU as an open heart recovery nurse, and that's when I was diagnosed with my PBC, so I ended up transitioning as a physician extender. So what I did was anytime our heart doctors got a consult in the hospital, I was the one that went and visited with the patients and got their history, what's been going on, what have we done before to treat something. So really digging into that so that our doctors had a good picture of what was happening when they were able to pop in for 2 minutes and actually see everybody. I then worked over in neonatal ICU with little babies, and it was always, it's bad for the babies, but neat to see when they were on URSO, the same thing I was on, and I could educate the parents and the staff and everything about that. Then I moved into, as I got sicker with my PBC, I moved into the electrophysiology office, which is a heart rhythm doctor. And at that point, I was the office nurse that we have all called 11 times and left messages, and we feel like they're not answering. They're taking too long to return our calls. We're having issues getting prescriptions refilled. I've been on both sides of that, so I'm going to give you some tips and tricks on how to handle that. In the middle of all that, that's when I got told, hey, it's time for you to get tested for a transplant. So we went through the testing process between October and everything finalized in February of 2021. I was listed on the transplant list on Valentine's Day in 2021. I was in a state that luckily was starting to do living donor liver transplants. IU Health had actually started that right in the middle of COVID. So they were seeing good success with that, and they said with my history and what was going on, I was a potential for that. So we started asking everyone and their brother. We were online posting about it. Some of my PBC patients, like PBC patient friends that were down in Texas, they had people, and they were all signing up, trying to see if maybe they could help me. And unfortunately, in August, I had a GI bleed, which can happen as your liver disease progresses. And while I was in the hospital having surgery to fix that, my score had bumped up quite a bit, and I ended up getting a deceased donor liver. We found out on Thursday, August the 12th. So by the time everything got done, I rolled into the OR just before midnight, so I was transplanted on Friday the 13th, which is no longer an unlucky day. It is my favorite day of the year. I celebrate it. 13 is my big number now. And so far, so good. Everything's doing great. There's been a few hiccups just with white counts and immunosuppressant therapy, but nothing we can't tackle. So once I was able to get back to work, I knew that donation was my passion and being able to advocate for donors, living donors, families. So now I work with Lifeline of Ohio. I am not a Buckeye fan, just saying. Notre Dame all the way, but so now I handle tissue donation, and I also take all the calls from the hospitals when they have somebody on a ventilator that may not make it. That's when they get involved for organ donation. And then if somebody does pass away, I evaluate the case and see if somebody could be a tissue or eye donor. I call the family, have that conversation, do all the paperwork, and help set that up. We also do placenta donation. So I've really thrown myself into donation, and I was telling some of the wonderful people I met last night, I ended up working for the organization that handled my organ donor, and I had no idea. So my first time ever going to the office, his picture and name was up on the wall, and they had just hung it up about 2 days before. So everything's connected. Things come around. Throughout that time, I've been an ambassador with ALF. They were between ALF and PBCers, that was who I got all my good information when I was diagnosed. Post-transplant, I started being an advocate with Indiana Donor Network, UNOS, the Global Liver Institute, and now I'm on the patient advisory group for AASLD. So we are planning our next program that will be in San Diego, I believe, in November. So if you guys have any interest in that, there is a patient portal, and they have fantastic speakers. So you guys came here now. It could be interesting to see what new knowledge we have even in November. So that's something to look at. And now we'll get into the meat and potatoes of everything. Being a PBC patient and even a PBC patient caregiver, it's a great big circle. Everything's connected. You're continually circling around. So this is going to serve as kind of our agenda for the day. We're going to talk about pre-appointment prep, what you're doing during the appointment, post-appointment, handling your chronic illness, because that's what PBC is, the social aspects of it, and then some caregiver support. So pre-appointment prep, we have all heard it, we've seen it online. PBCers website has a great list of questions and stuff, and we're working on improving that. I talked to Carol, and we can take these slides and I can break them down. I was going to do like special Canva brochures, but I may just post these slides so y'all can take with them, pick apart what you want, but they will be available for you guys so you can make your lists. The first thing is gather your records, and that can be hard and you don't know how to do it. You want your labs, you want radiology reports. You have access to your radiology reports because a lot of times you may have gotten scans at your local hospital, then you saw a GI doctor somewhere else, and now if you were lucky enough to get sent to a liver doctor, they're at a university facility 3 hours away. And it's really funny that a lot of times those requests from the doctor's office come via fax still in this day and age. They get lost, they get thrown away, they get faxed to a different place. It's a mess. So the best thing you can do to make your appointment meaningful is come in with your info. Copies of your labs, you can print those a lot of times now just off of if you've got like a MyChart or a dashboard that your physician provides to you, or you can contact medical records. Like I said, you have a right to all of your medical records. You can check online for the facility. Sometimes there's an online form. A lot of times they want you to sign a form in person. If they do accept an electronic one, it can take up to 2 weeks to get those. So you need to plan accordingly to get your things. And while you can have the paper printout, the radiologist at my little backwoods Band-Aid Station hospital may not know to look at that liver scan the way a hepatologist would. So always get copies of the discs, and they have to provide those to you. So they'll give you a CD that has the exact imaging. I've even had, they did my biopsies, I requested the actual slides that the pathologist had put on, and I take those to every doctor's appointment. And we may have gotten a microscope and looked at them a few times ourselves, just to kind of see what they looked like, because why not? So be prepared with that. Call the doctor's office or send a message if you can via MyChart and see if they want any labs done prior to your visit. Because it's very annoying to drive 3 hours to the hospital and they say, well, we don't really know what your numbers look like today, so let's just wait and we'll call you later. That appointment is no longer meaningful, in my opinion. I've just went here thinking I was going to get answers, and now, meh. So you have to be your advocate. I want to come to this appointment. I want to have all my ducks in a row. We're going to have a good sit down, and I'm going to leave feeling better about everything. So check on that lab work. Insurance, we all know how that goes. They may be iffy about doing some of the testing, so contact your primary care doctor. They can put in the diagnosis code, so it's not this has to be done after you see someone. And again, that's being your own advocate. If it's your caregiver helping you with that. Some hospitals, and I'm really pushing for this program, offer patient advocates to you that can help navigate that. If you're doing this on your own, everything's done online now. If you're 70 or 80, you're not comfortable with it, fine, they will jump on and help you kind of navigate that. I have people in my community all the time. I'm from a very small town in Indiana, and I probably speak to 4 or 5 people a week and explain how to do this, or do you need me to come to your appointment with you? Here's the questions you should ask. So there are resources available. Don't be afraid to ask. Let's see. Always check where they want the labs done so that they have easier access. If that can't be accomplished with insurance, get those copies and take them with you. And make sure there's nothing that is a send out, or if it is, you've got time to get those results. Especially some of the ANA testing, it can take a couple days turnaround, sometimes up to a week. So make sure you are prepared ahead of time and have all of that info. That way everything can just be a better appointment. Know where you're going. I have been told before, oh, your appointment is with this doctor at IU Health. And I'm thinking, oh, I'm going to this big building on Michigan Street. No, on those Tuesdays, he's up in Carmel, about 45 minutes away at this other office. I didn't know that. So make sure you know where you're going. Map your directions, have a printout in case your phone's not working. Ask them where parking is. I've had places where the parking garage is 3 blocks away from the doctor's office. And for some of us, that's a good haul. So have your person that's going with you drop you off at the door while they work on parking. Make sure you know if you need money for parking or if it's validated, because unfortunately at some of the big hospitals you have to pay for parking. So that's another way to be prepped, because if you don't know that and you get up there and now you're confused, you're stressed, now you're itching even more because you are stressed and you've gotten hot and sweaty and gross and you feel like you're running late. So be prepared. Get that Boy Scout, Girl Scout motto going. Take your medicines. And if I am first time seeing a patient, I want to see the bottles with the labels, with what doses it is, if there's anything added in. That way we know the manufacturer in case we know of something maybe iffy that's going on. After your first few visits, you don't have to do that. If you start something new, take that to them. Make sure they've got it right. It is very easy in the age of electronic medical records for a nurse to see, well, I have Tacro because I'm post-transplant. I have a 5 milligram pill and I have a 1 milligram pill, and because we're constantly adjusting the dosage. And I will have a doctor's office mark off the 5 because they think I'm just taking the 1. And then I'm like, no, I'm still taking it. So really stay on top of your med list. When the doctor's office is just reading names, be like, hey, I want to check the dose on that too. Make sure that's right. Any vitamins, supplements, take those bottles so they can see if they're even like FDA approved, if they think it could be something that could hurt you or not. So go in prepared. And now the question list. This is something we see a lot. There are so many great resources and questions I see from people that I've not thought of. So I always like popping on to the PBC group on Facebook, the ALF PBC group. I think both of them have a pinned post at the top with questions and people add in the comments. These are some of the big ones that I think are important. You can take what you want. What is PBC? Is this a confirmed diagnosis? How many patients do you treat? It is okay for you to ask that. Do not feel bad about hurting that doctor's feelings. They are working for you. You are not blessed by them to be in their presence. They put their pants on the exact same way as you do, okay? Do you need to follow a GI or hepatology? And myself working in healthcare, I remember my mom sitting at that first appointment with the gastro, and she was like, can you even handle this? Like, when do we need to go to somebody over you? And I was like, we don't talk to doctors like that, Mom. Oh my gosh. And my doctor was she was like, I will handle you until I feel like it's out of my hands, but I will not hesitate to move you along. And that's what your doctor should say. If your primary care is telling you, oh, I can handle this, no, I want that gastro referral, the hepatology referral. Sometimes it takes 2 to 3 months to even get on the list up with the hepatology office. So it is not mean or rude to ask for that referral because it can take some time. I remember we were trucking along and then my doctor was like, okay, I think it's time to send you to a transplant center. We're freaking out. We're like, oh my God. They put in the referral and they're like, oh, that was October or November. Kept not hearing anything, so I called up to the hepatology office and they were like, oh, we're not looking at referrals till February and then we'll call you for an appointment. And I'm like, I've been told I need to go to a transplant center and now I'm not getting an appointment even looked at for 4 or 5 months. So I was very lucky. My uncle did CrossFit with some guy whose father-in-law was the head of hepatology at Vanderbilt. So he called and pulled some strings and they got me down there immediately. And when your PCP or gastro says you need to go to a transplant center, they don't necessarily mean you need a transplant. Because when you get to a hepatologist, you have your hepatologist, your liver doctor. Then they decide, okay, maybe you need to see a transplant hepatologist. So that's the next step on the ladder. And then if they think, okay, this is definitely happening, that's when you move to your transplant surgeon. So to my little doctor down in Boonville, Indiana, transplant center, but it wasn't even. And the first doctor, because once IU found out I had went to Vanderbilt, they magically got me in a little faster. And the doctor was like, why are you even here? You don't need a transplant yet. We need to be treating your liver disease, so I'm putting you in with this hepatologist. And I was like, I didn't know. They told me I needed a transplant. So make sure you're seeing the right person and ask about it. It's okay to ask. You are there for you. You have to make that appointment meaningful, and it's your life. So don't feel bad about asking those questions. Going over treatment, how long will I see treatment to take effect? A big thing we see is I got put on URSO and it's been 2 months and nothing's changed on my labs. That's pretty usual, but I didn't know that going into it. And I also thought that ALK-Phos was the end-all be-all, and the higher it was, the closer I was to death, and it's not. You look at your bilirubin and some other things, so ask what those labs are going to mean to the doctor and what it means to your treatment. What are signs of something that's urgent that you should go to the emergency department? Labs, how often? When do we need them? Things like that. The labs I need to worry about. ALK-Phos, your bilirubin, and just have that conversation so that everybody's on the same page. You're not stressing and calling the doctor because your ALK-Phos went up 20 points. And they know, well, it's not a big deal. I don't need to call them back right away, but you don't know that. But if you ask that question in that initial appointment, that'll make a big difference. How often for FibroScan or MRI with elastography? And hopefully your facilities have it. If not, you can ask them to send you to a facility that does FibroScan. The FibroScan is great, but it is affected by your body habitus. If you're a little extra fluffy, your facility may not have the probe that's made for somebody with the extra thickness like I've got. So that can skew those results. The MRI with elastography, it's newer. Not a lot of facilities have it. And IU was just getting it, I believe, in like 2018. And they had told me, they're like, we've got this stuff, we're setting it up, we're still using it, we're figuring it out. And I just asked them, I said, well, can I be one of your guinea pig patients? So I got to show up one day, and I was one of their practice patients, so insurance didn't have to cover anything, and we got to see what it looked like. And it's kind of like doing the FibroScan, but you have a pad wrapped around your abdomen that's doing the vibrations, so they're getting a better picture as a whole, and it can really show some differences compared to your FibroScan. But ask that. It's okay to ask. If it's new, they've got to train radiology students. If it's a teaching hospital, they have new, the radiologists, the ultrasound techs. They're always having to learn on somebody, so you might as well volunteer. As far as diet restrictions, that's always something to ask about, and not necessarily restrictions, but recommendations. Current medicines, that's the big thing we see. It's a weekend on one of the Facebook groups and I'm having pain and I don't know if I should take Tylenol, ibuprofen, whatnot. Ask your doctor, because we all know it's going to come up. So figure out what they think is best for you and your picture of health. Antibiotics. There is a great database online called Liver Talks, and it will list meds and tell you how they affect the liver and if they're recommended for liver patients or not. And I have had so many ER doctors that I've given that information to when they've tried to prescribe an antibiotic, and I'm like, that one's at the top of the list that I can't have. And they didn't even know about liver tox. So go in armed when you're having these appointments or these random things pop up and you're at an urgent care that may not even have access to your chart to even know that you've got PBC, let alone they don't even know what PBC is. Alternative therapies, sometimes we can use those other things, sometimes we can't, depending on your degree of liver disease, and I think that's a conversation between you and your care provider. Just because somebody online says they are doing all this, it may not be a good fit for you. So that's a definite conversation to have with your care team. And then transplant timeline. It's always good to ask. Like I said, I was told I needed a transplant. I went to the appointment and the transplant doctor I saw was like, we don't need to see you yet. So it's okay to ask that. I did break it down into more in-depth questions and I will provide these to you all. I'm gonna post each group. As far as symptom management, we know about the itching, the fatigue. The fatigue medicines, they are out there. If you are having fatigue, please ask your doctor about it. There's a few medicines that are typically used for people that work night shift, but you can do a prior authorization off-label use for PBC patients because of the fatigue. And like I said, it can take a prior authorization, a couple forms or notes from the doctors, but it typically gets covered once they know that. The GI upset, what's the best thing for that? And you may need to adjust the timing on your medications. And documenting your symptoms. Go to an appointment and be like, okay, every day, 8 o'clock, I'm itching already. Or here's when my fatigue sets in. A doctor needs to see a good picture. They need to see evidence. I could have somebody coming in with heart palpitations that they're telling me about, but if I've never seen a picture of it, I don't know what to do with it. So you need to document your symptoms. Is it annoying taking a little notebook around with you all the time? Yes, but there is an app, the PBC Living app, and you can go in every day, multiple times a day, and you just search on your app store, PBC Living, and you can document your symptoms. Today was a fatigue day. It's even got an outline of the body, so you can say I was itching on my elbows or on the bottom of my feet. And that is a good way to document and have good data for your doctors when you go into that appointment. Questions about pain and determining what's actually PBC pain. I feel like that's something big that needs to be discussed because some of us have other things going on, and also online on some of these chat groups, you'll see people that blame everything on their PBC. And I've had people that have missed kidney issues and everything else while they're swelling and they thought it was their liver. And then now they've got some kidney disease that was totally unrelated. And that goes along with your swelling and edema. Monitoring daily weights. If you are to the point where your liver disease has progressed and you have ascites, get you a little fabric measuring tape and measure your belly. Because if you're having to go in for thoracentesis, which is where they have to draw some of the liver or some of the fluid off around your liver, you need to be measuring that and ask the doctor, when should I call you? If I've had a 10-pound weight gain in 2 days, is that when I need to call you about this? Labs, as always, watching for high bilirubin, any jaundice levels. You're going to be watching your ALK phos, your AST, ALT, your INR, which is blood clotting, which can be a good indicator of you having more diffuse liver disease and possible some liver failure going on. Your creatinine, and then platelets. Imaging, like I said, the biopsy, take it or leave it. If your doctor doesn't immediately say, oh, you need a biopsy, I'm kind of like, all right, they know, they're up to snuff on everything. But FibroScan and then the MRE is fantastic. General care, we see these questions a lot. Vaccinations, what should I do, what should I not? And your primary care is gonna tell you, I don't know, ask your doctor. So if that's something you check on your very first appointment, you've already got that info. So now you've had a good appointment with your liver doctor, and you're gonna go back to your primary care and not now be waiting and then have to have another appointment that you have to pay your copay for just to come in and get your shots again. Chronic management, we're going to go more in depth on that. Info about your caregiver. A lot of facilities have a good caregiver plan, so ask about that. Travel, see what their recommendations are, their places you should avoid, not avoid. And normally it's, if you're smart, you can still go and do. PBC does not tie you down at all. Keep living. Research study options. I've participated in the research study for Ocaliva. And for people that are on the fence about research studies, the medication became available while I was in the study. And my numbers were still looking a little eh. And my doctor was like, okay, we're gonna pull you out. I'm not keeping you in the trial just for the sake of having a body in the trial when I know it can help you. So don't be afraid about, oh, if I get in a trial, then they won't give me the good stuff or something like that. And then a lot of your labs are covered under that deal. So I ended up, I think for my trial, we were doing labs every 3 months, EGDs every 6 months, different scans, like the bone density screens and stuff like that. And hey, that was all covered by them. And they paid me to go up there to do it. So it was a win-win for everybody. And then as far as medication costs, what programs does that doctor's office or that facility have in place? We are lucky because we have the assistance fund available to all of us as liver patients. There's an assistance program for Ocaliva. Now, if you're to the age where you're at Medicare status, a lot of those little insurance or those drug cards that are like, oh, get your copay down to $0. When you read the fine print, if you're in Medicare, it doesn't count. So a lot of facilities will have, ours locally is called the MAP or the MAP system, and it's Medication Assistance Program. So you submit sometimes your tax forms, your cost of your medicines, and then they work on it. And a lot of hospitals have a fund set aside where they can help you get your medicines. Please, please, please don't take a medicine because you can't afford it and not tell anybody. Because your doctors do not know how much these medicines cost. The nurses don't know when they're writing that prescription. We have no idea. And there's a heart medicine that a certain dose was costing patients $300 a month. I could write the prescription for the same medicine at a lower dose and just say take 2 pills instead of 1, and it was $3. I didn't know that till I called the pharmacy because I was like, I'm seeing all my patients getting readmitted. And they said it's because they can't afford their stuff. And I didn't know, oh, there's a cheaper version of this. Your pharmacy a lot of times isn't going to say it because they're trying to make money. So question your medication costs, question the programs that are available. And then any support groups, educational resources your facility has, and like I said, we're going to talk about palliative care, and we've mentioned the liver tox database. During the appointment, bring someone with you. I don't care if it's a random friend that you really, you're not close with. If you just need somebody else there, because it's very easy to get tunnel vision and be scared about what they're saying and you don't hear anything. So have somebody else there that can take notes. Give them your question list so they can go over it while you're sitting there kind of spiraling. If it's a friend or a family member, they're going to notice when you're not able to really take in what the doctor's saying. Record the visit. Everybody's got a cell phone. There is a record feature on there. Technically, you should tell the doctor certain states, or you have to let somebody know that you're recording, but just be like, I want to make sure so I can go back and listen, so I'm not calling and bugging you later about questions. A big thing I have found is when you get to that new appointment, you don't know how the doctor handles visits. And asking that registered nurse that comes in or their CMA that rooms you, how does the doctor do their visits? I worked for a doctor that was we called him the cyborg before I worked with him, and we always laughed. I was like, if something happens to my heart, I'm gonna make him take care of me because he's just so mean and flat and angry, and I just wanna bug him. Well, I found out he was actually a really great doctor. He was afraid of offending anyone, so he didn't laugh or joke. He was just trying to make sure He kept it legit, and he was one that reviewed your history and everything, and he wanted to come in and do his assessment first before he heard what you thought your problems were. And so patients would complain. They were like, he was rude, he cut me off talking, and that's because he liked to get a picture before he had it skewed by what we had to say. So I would have to explain that, and some doctors want to sit and have that little buddy-buddy chat before they really get into your evaluation. So ask the nurses, ask the staff, what do they prefer? Provide a copy of your questions, and again, especially now with healthcare, there's a lot of shortages. Typically, we would review the patient's charts the day before the visit. Kind of prep, write a little paragraph of the history, what treatments have been done, what worked, what didn't work, so the doctor had that going in. Sometimes your nurses don't have time to do that. So have your questions. If you have an availability for a MyChart or patient dashboard, send those questions in. Some staff is able to look at them beforehand, or they'll at least print them out before you get to the visit. But that's a good way that the doctor knows what your questions and concerns are. They've seen them. Maybe the nurse can already kind of fill in a few answers for you. So some doctors will be able to work with that. Sometimes they won't. Some offices, they're seeing 40 patients a day and in between running and doing procedures, but that's just a good way to make sure your concerns are heard. And then as far as follow-up, any labs or testing ordered, where do they want it drawn at? Do I have to be fasting? And then how do I get the results? Are you gonna call me if they're bad, or are you gonna just send me a message on the MyChart? And what are we looking at? What is something I should be worried about, not worried about? And then will I be contacted? Like I said, is the doctor gonna call? Is the nurse gonna call? Or if I don't hear anything, is that good news and everything's status quo? Post-appointment, go outside and breathe, dance around, do whatever you need to, take a mindfulness moment and just think, okay, here's what I went in stressed about, here's what I've got some answers on, here's what I'm gonna focus on. And you can wait a day or two to kind of digest and absorb everything. Involve your person that was there, or if your partner and caregiver, whatever, couldn't be there with you, let them read through, see if they came up with any questions. And then you can send those follow-up questions to the doctor. Again, hopefully during the visit you asked, do you want me to call with these, or would you prefer to send them through MyChart, dashboard, whatever, and then make your plans for your follow-up labs, testing, images. So that in a nutshell is how I like to handle appointments. And like I said, everybody does everything different. I'm gonna briefly talk about palliative care. I think I posted some polls about that. Palliative care is healthcare, not death care. And it is mainly for managing symptoms, medications, and treatments. My primary care is here. My diabetes doctor's here. My liver doctor's up here 3 hours away. Palliative care can be like, oh, I'm gonna be the coach that's sitting on top of that and deciding, okay, we need to contact her liver doctor, or I need to contact the diabetes doctor. And that palliative care team can do that communication for you, so you're not spinning your wheels. And when you have somebody that's in the system, they can shoot a quick little text message to that doctor instead of you calling the office, waiting on the nurses to finally get the phone calls at the end of the day, or finally able to respond to an online question. So palliative care is amazing. It covers social aspects, your actual illness, and then the caregivers. They provide social and emotional support with the medication assistance programs and counseling. And counseling's for you and your caregiver, and they will do it separate. So I always felt like my palliative care counselor was the one person I could go to, and if I was scared or nervous, I could actually cry to them. Because my role as like a nurse for open heart patients, I always felt like, oh, they're way worse than me. I should be stronger than this. But with that palliative care counselor, I could just let it all out. And I knew, like my husband, he was trying to be strong and tough, but I knew he was having issues too. So then he could go talk to her and kind of get some of his fears out, and he didn't have to worry about stressing me even more, and vice versa. And then, like I said, they've got the caregiver support, and then they can also help your caregiver, your partner, understand the fatigue and the itching more than you just being like, I itch all the time and I'm so tired, and it causes a rift. That palliative care team can kind of help provide them some support, some education. If it gets to the point where you're needing so much assistance, there are respite programs where they can take the day and just kind of walk away, and somebody else will come in and help you. So palliative care is one of my favorite programs. There's not enough of them. We need more people asking for it so that we can get better funding for palliative care. If you have more questions about that, please reach out to me because I could do another like 2 hours just on palliative care. And I know we're getting close on time. The big thing to know is palliative care is not hospice or death care. It is, like I said, they're the coordinator over everything that you have going on. And they, a lot of times, can really take the reins on making sure that your medications are getting paid for, that testing is getting ordered with the right codes, to make sure insurance is going to cover it and things aren't going to be a lot of back and forth. So with palliative care, you're making your goals of care. It is not, this is how I want to end my life, it's how I want to live my life. So it figures out how you're going to manage your chronic illness, if you want to go farther with treatment, if you don't, how you're going to handle things if things get worse. And by doing that, you need documentation of your plans and wishes. So a healthcare POA, or they call it in some states, just a medical POA or agent of the donor, and they make decisions when you do not have the capacity, and that is a legal form, typically should be notarized so that everybody knows it. You want a copy with you at all times. Your hospital should be scanning them in, but I have seen so many notes that, oh, it's all scanned in, and it was not scanned in, so keep a copy with you. So if something happens, and it may not even be related to your liver, that you can't make decisions, they know who is supposed to be your person. With a living will, that's where you determine, do I want resuscitation, do I not, artificial nutrition, or am I leaving all of that up to my healthcare POA? And you can also designate if you want to be an organ and tissue donor, and even line by line, I'll donate my heart, but not my lungs, like step by step. So a living will is very important. We also have something now called a post form, and that gets even more in depth, which is great for chronic illness patients because you can set timelines for treatment modalities. Post-transplant, you may need dialysis. Okay, well, I'll do dialysis for 6 weeks. If it's not working and I'm still on the ventilator, I can't make the decision, we're done. Different nutritions, okay? If something happens, I'm on a ventilator and they want to do tube feeding, this is how long I will allow that. So you can make those decisions, and it's important to make that as an informed decision. And your palliative care team can help with that. But if you don't have palliative care, and I've just posted an example of the post form that we use in Indiana, but you can determine medical interventions, your DNR status, if you want antibiotics, nutrition, additional orders. But not everybody has this available. So this website, please jot it down, and I'll post it also. You can make a portable medical orders, and it is like advanced planning, and this website goes through with videos and talks you through step by step and explains each question and why you would want to do it this way or that way. So you could go online and do all of that and then at least take it to your primary care doctor the next time and say, hey, I filled out this form, can you sign it and put it on my record for me? And this website, I know it's in Spanish, English, and I believe Chinese. They're working on getting it in more languages, so I feel like it's pretty accessible for everyone, and they are accepted in every state, so that's exciting to know. And I've just included their brochure. It really breaks it down. Who's your decision maker? Decide what matters, your flexibility, what you want for your medical wishes, and then different questions that you may need to take to your care team. So this website, Prepare for Your Care, is the one that has the good videos. So definitely check that one out. And again, that's just prepareforyourcare.org, and I'm going to post this for the group also. If you and your doctor aren't working, it happens. You can fire that doctor, okay? We would prefer, you do it nicely. First and foremost, if you feel like you're not driving, ask to speak to the nurse. Because like I said, they may give you some insights. Here's what this doctor does or doesn't do. He's not laughing and smiling because he doesn't want to make an off-color joke. Can I see a nurse practitioner or a PA in the office? And then they go to the doctor. Because you may love the care you're getting, but you don't like that communication. I have patients that always see our NP, but then they go talk to the doctor and say, here's what I'm seeing. What do you think about this care plan? So that's an option. If you think their behavior is unacceptable, by all means, ask to talk to the office manager because they can review things. If they're getting the same complaints, then they'll have a sit down with that doctor and try to curb things. Unfortunately, in this day and age, you gotta check with your insurance, see who else is covered, and be aware that your liver's not causing everything. And just be open to that. And like I said, you may have kidney issues that you keep blaming on your liver and never see a kidney doctor till it's too late. And then my final thing is it's Donate Life Month, and we do have some transplant recipients in here. So afterwards, we're all going to meet up and do our blue and green because it's National Blue and Green Day. If you guys have questions about donation, please reach out to me. I've got some of the Donate Life bracelets, and even any questions about registering as an organ donor. It's never too old. You never have a medical condition that could prevent you from even being a tissue donor. We still use people's corneas, even if they've had cancer or have active cancer at that time. So never take yourself off the registry, because all of us sitting here have been told at some point you may need a transplant. So we want to make sure everybody's educated on it and willing to be a donor if you're hoping to get something from a donor. So that's what I have. Do you guys have questions or comments? And I know we had some polls.
Leslie has a few questions that have come up. Thanks for the presentation, Jess. And I know you mentioned about the bracelets, as well as I know Carol has some leis, blue and green leis, that during the break, the next coming up break, we'll have people go outside and kind of gather around the pool or in the shade, whatever, and take pictures for that. One question I wanted to kind of touch on, we'll have a chance for some more questions during the panel discussion later as well. But as you know, you mentioned a lot about kind of the doctor-patient relationship and the questions to ask them. What about the other care team members, like the dietitian, the social worker? And what about addressing that if your office doesn't have a dietitian, a social worker, et cetera?
I would check with your liver team first. If that's not working, check with your primary care doctor. But you can also look into your facility. Your local hospitals normally have a dietitian on hand, and you can contact them, and they will have support groups for healthy eating, and that's a good way to get your foot in the door with the dietitian. If your doctor can't provide it, see if they have recommendations that they can at least give you, even if they don't have one on staff, and just ask those questions. Reach out to your friends that work at a hospital or a different facility and see what they have available. So really be your own advocate and fight for that. Maybe you're the one that gets started a dietitian program for your area.
Cool. Awesome.